All right, folks, we're probably going to get started right now. If everyone could please sit down, that would be really appreciated. So welcome to our Holistic Wellness Panel event for the Poverty Action Day 2019. We're really excited to have so many people here. And just to give an overview of how many partners are involved, this event includes Feed Berkeley. Ooh, thank you. Basic Needs Security. The Blum Center at Berkeley, which has kindly hosted us. This is also being live streamed at the Blum Center at Merced. So, yeah. And this is also part of the Net Impact Fellowship. So we're really excited to get started. So again, if you haven't already, just go to this link. If you checked in, you already filled it out, it's fine. And then at the end of the event, we'll be doing the drawing for the Sustainable Milk Tea Kit. Just to give an overview of the things we're going to be going over, we're going to be talking about an overview of basic needs and essentially the purpose of this event, and then we'll dive right into the panel questions. The folks at Merced have organized a viewing party, so we're going to allow them a chance to ask 2 or 3 questions for the panelists, and then we'll break out into having a Q&A for the folks who are present here, and then we'll do the closing and raffle. So this is an introduction to the planning team. So Chloe is currently our tech person, so she's in the office there monitoring the live stream, but she's the innovation program coordinator for the Blum Center. She graduated from Berkeley with a degree in peace and conflict studies in 2016. She uses she, her pronouns. And my name is Sara. I use she, her pronouns. I currently serve as the community programs coordinator for the Basic Needs Center, and I work as the Berkeley ambassador for the Student Action Council for the Eradication of Poverty, which is a program of the Blum Center. And I'm a Net Impact Food Fellow. And at Merced, we have Frank Ortiz, who is a student assistant with the Blum Center at Merced, and he's actually the founder of the student group that works throughout all the UC system for Poverty Action Day. He's really wonderful, and we're really excited that he organized a viewing party for us. We also have a couple of special guests. Vikram Pada, he uses he, they pronouns. He's the CalFresh coordinator for the Basic Needs Center. We also have Joyce Huchin, who is the CalFresh ambassador for our team. And we actually also have a delegation from Davis, Ryan Choi, who represents the Aggie Compass Davis. Ryan, if you could raise your hand. He drove an hour to come here. Woo! And I am more than excited to introduce our guest speakers. They come from a wide variety of backgrounds, and they are exceptionally, exceptionally wonderful. So we're really happy that they are willing to stay after 5 p.m. on this campus, which is apparently very hard for staff people. So first, our first speaker is Kiyoko Thomas. She is the Basic Needs Manager, where she leads crisis intervention and overall basic needs programming efforts. She received her bachelor's in sociology from UC Santa Cruz and a master's of social work from San Francisco State. And prior to this role, she actually served as the program director for the Willow Rock Crisis Stabilization Unit of the Seneca Family of Agencies, which is a 24-hour program helping adolescents experiencing psychiatric emergencies. Our next speaker is Joyce Lee, who is the Campus Food Equity and Inclusion Policy Fellow at the Berkeley Food Institute. She is also a second-year MPH candidate in public health nutrition, and she's simultaneously pursuing credentials to become a registered dietitian. And her main research interest is addressing food insecurity by promoting access to healthy and affordable food. So if we could get a round of applause for the speakers, that'd be great. So just an overview of what basic needs is. When we're looking at basic needs and security, we're not looking at just food and housing and financial insecurity in silos. We're looking at how these 3 factors come together and impact a person's holistic wellness and a person's ability to thrive in whatever capacity they wish. And that's why we named our panel today Holistic Wellness. We're not looking at just these topics in silos. We're looking at how all these different topics intersect. The UC Berkeley Basic Needs Committee encompasses a wide variety of stakeholders, students, campus administrators, staff, faculty, and community members who are working to address food and housing insecurity on our campus. We just started just a few years ago with beginning with a food pantry, and now we've evolved to just opening our Basic Needs Center just 3 weeks ago. And we have over 100 leaders who are students leading different initiatives across campus. In the past year, we had over 22,000 visits to the food pantry. Over 8,000 students, unique students, were served through our relief programs. And our partners are statewide, UC-wide, going from the UC Office of the President to the Berkeley Food Institute to the UC Student Association and the Global Food Initiative. When we're looking at addressing basic needs insecurity, we don't want to look at people who are in crisis right now and just at them. We want to look at how we can prevent people from being in those situations in the first place. So we use this sort of inverted pyramid to look at how we can prevent people at these different access points and how we can target our programs to effectively reach these populations. So that starts all the way from pre-UC to CalFresh to crisis resolution. The next few slides is just a bit about the data. This was collected from the first study of its kind on such a large scale of food and housing insecurity across the UC system. And we found that 44% of UC students experience some type of food insecurity in the undergraduate population. And this means that they lack consistent access to nutritious food. So the Thai food that you're eating today, they probably don't have consistent access to that. And we noticed that when we're doing a 2-factor or 3-factor test, that certain marginalized communities disproportionately experience higher rates of food insecurity. And this can lend to our efforts in looking at which populations are most at risk and how we can adapt our outreach programs to reach these folks. With homelessness, we see the same thing. The UC system-wide rate is 5%, but at Berkeley, it's 10%. It's also not hard to imagine why. Business Insider named us the most expensive college town in the country, so we're still #1 in something, but that's not a good thing. And finally, this is one of the most important slides here. It's how does food insecurity impact your GPA? How does not having consistent access to food impact your ability to do well at school, which is the whole reason, you know, you're paying like either over $30,000 or over $60,000 or even more if you're an international student just to be at Cal. When you are lacking consistent access to food, when you're constantly hungry, you can't focus on class. You might not be able to go to office hours or study groups or forward books that can help you succeed in class. And we noticed that consistently across all 4 years, people who are food and housing insecure have lower average GPAs than people who are food and housing secure. And what's especially troubling is that the average GPA, if you look at freshmen, is a 2.85. And we all know that the GPA you need to apply for most jobs is 3.0. So they can't even qualify to apply for a job that would give them wages to get them out of the situation that they're currently in. Some of the ways we help include CalFresh, Food Pantry, and the Food Assistance Program. This is just a broad overview of some of the ways we try to relieve and alleviate the food and housing insecurity crises on our campus. And with the Food Pantry, are there any Food Pantry volunteers here? Woo! You can ask them more questions about their wonderful, wonderful experience at the Food Pantry after this panel. But any person with a Cal ID can go to the Food Pantry. It doesn't matter if you're undergrad, or grad, staff, or faculty. As long as you have a Cal ID card, you can go in and get food to immediately alleviate your hunger if you're in a situation of crisis. With CalFresh, Joyce just walked in. She's our wonderful CalFresh ambassador. CalFresh is the California version of SNAP, which is the Supplementary Nutrition Assistance Program. It provides up to $192 per month in supplementary food assistance. And then for the Food Assistance Program, that's a program operated by the Financial Aid and Scholarships Office, essentially targeting people who are waiting for their CalFresh benefits to kick in or for people who aren't eligible for CalFresh. So if you have any questions at all, we have a lot of folks representing basic needs in the audience tonight. Feel free to ask them afterwards. We also have some outreach materials over at Lauren's table there. So you can also go there to get some materials. So now we're going to get started. So do you want to do the mic check? Okay. Our first question for our esteemed panel speakers is, what is your perception of holistic wellness?
I think the idea of holistic wellness for me, I think about this inner connection of mind, body, and spirit. And so often, you know, the idea of mental health being an integral part in terms of also what's really important in terms of our being. And so really, you know, giving credit and lifting and acknowledging that all parts of our being are just as important. So again, not just our ability to be physically healthy, but we're also conceptually understanding the ways in which we exist and why that's really meaningful when we think about basic needs, that mental health, physical health and, you know, our overall sense of wellness is deeply connected.
I also think about it coming from a public health background where what Berkeley really strives to teach you in the School of Public Health is that your health is determined by all these different type of factors, and we can see this as like the social determinants of health, and it's really looking at different influences in your life, such as your lived experiences or your experiences growing up in a certain culture, in a certain religious background, in a certain social background, social economic status, your own personal challenges and barriers, as well as like the ones of your privileges that help shape your ability to access resources to health. Like, they're all important things to consider when we talk about the health of our well-being. And like Kiyoko had mentioned, it's not just your physical health, like everything that pertains to any sort of your well-being, whether it's like physical or emotional or mental, like these are all things that we consider as a holistic part of health.
So following up on that, since we have you two being experts in mental health and nutrition respectively, Kiyoko, would you mind talking about maybe some of your past anecdotes with how mental health intersects with basic needs security and how that manifested in different situations you've seen when you were working in the crisis wing?
I think this is probably no surprise to all of you, but one thing that's really critical, so in the past when I was providing direct clinical experience, so for example, when I was providing therapy in the context of a high school, students who were meeting with me, if they were not eating on a regular basis, I'm sure you could imagine that was really difficult in terms of their ability to concentrate or to be able to focus on a session that we were having. So it was something that was really important, that I wasn't really just meeting a student's mental health needs in a vacuum, but having conversations around all their other domains in their lives. So really, again, making sure that we had conversations about what was happening at home. Did they have access to resources? Part of the framework as a social worker that you always want to be thinking about those different domains. And again, even, you know, again, as Maslow's hierarchy of needs in terms of being able to self-actualize and to focus on your mental health needs, it's very challenging when you haven't had a meal. And so that was something that's really critical. The other thing that we see is that, you know, in the public education system, there's the free lunch program, which is really a critical component of a student's success, being able to actually have a meal every day. And so it's unfortunate that when students graduate and then enter a higher education system, they're somewhat, you know, on their own, having to navigate, you know, getting resources, especially for food. And so that's something why we at Basic Needs really try to make sure that before just jumping in and addressing any sort of crisis or mental health, but we're thinking about sustainable solutions to connect students to resources. Because, you know, the point of this panel is also to discuss the way in which not having access to consistent, healthy food really does not just impact one's mental health, but their academic performance.
I just wanted to add on, since Kiyoko talked about the National School Lunch program as well. So I recently went to visit the Oakland Unified School District, and what they've been doing more recently is trying to incorporate the fact that they can have a free breakfast available in classrooms themselves. So they'll dedicate time in the classroom so students can make sure to eat like a breakfast and then participate in class throughout the day as well.
So Joyce, given that your expertise is in nutrition and public health research, are there any common themes that you see in conducting research about the intersection of nutrition and basic needs?
Yeah, so a really important component of basic needs is looking at food security and making sure that people have consistent and dependable access to enough like affordable and healthy food. And there's been many research studies that have shown that food insecurity is tied very strongly with people. It's tied very strongly with people who don't have like enough access to financial means. And so, for many low-income communities, like they are the ones who have been disproportionately at risk of like food insecurity, and then that will later pertain to a higher risk of developing diet-related disorders such as like diabetes, heart disease, and all of like strokes and all of the other corresponding illnesses that we see. And this is really important for all of us to address, because not only is this something that is a striking inequity in terms of health, it also means that millions and millions of healthcare dollars that could be saved in terms of prevention is not currently being acted upon as well.
Thank you, Joyce. I also wanted to welcome Maria, who is our graduate fellow from the Global Food Initiative, and she actually wrote the whole year-long report, along with Regina Kim, who's sitting in the back. So if you're interested in more basic needs research specific to the Berkeley campus, feel free to talk to them after the panel. So our next question is, specifically at UC Berkeley, what are some of the gaps that you see the school has in order to allow students to reach holistic wellness? What are some of the barriers that you've seen in your day-to-day lives?
It's interesting. So I think for the context, for those of you who aren't aware, I joined UC Berkeley Basic Needs team. It was in the fall semester, so in September. And so still fairly new, and so it's interesting to come in with a fresh perspective. And so for me, I think I've been trained to think from a more systemic perspective in terms of the way you approach issues such as basic needs. And so right now, I think to this question, there are various departments on campus that all touch a student. So that could be an academic department, financial aid, housing, what have you. And part of what has been shown to be effective are models that really address particular issues, again, from the systemic perspective. So in a lot of other contexts, more of a wraparound model can be really effective in a coordination of care. So right now, again, with a student experience, you may be going to financial aid for one issue, being sent to Cal Housing for another issue, and those efforts aren't necessarily coordinated. And so and not to mention mental health, that's also a separate department. And so with an individual who might be experiencing some complex needs and have issues related to stressors of food or housing insecurity, you have to navigate all of those different departments without that coordination of care. And so that's something for me that still feels like a gap that I think we're really trying to develop at our Basic Needs Center to really be a hub. And really try to think about the way that we're coordinating care and the experience for an individual student who might have to navigate a lot of different departments. And so even within our model at the Basic Needs Center, that's really important in terms of how we're bringing in folks from financial aid and housing and Alameda County Food Bank, so that a student doesn't necessarily have to then do that sort of resource navigation exhaustion.
At the Berkeley Food Institute, I'm currently working on a project that's trying to really look at what type of food is accessible on campus. And so currently we formed the Coalition for Campus Healthy Food and Beverages that's really trying to promote just general campus wellness and health based off of the food that's available to all of you. So currently the project is looking at the beverages that we have on campus, and we've seen that at the moment Berkeley is in a pouring rights contract with PepsiCo company that is supplying most of the beverages, and you can see it all across what we have on campus, including the recognizable brand of Pepsi, but also any of their partnering beverages as well, such as Bubbly, which is a carbonated drink, Aquafina, their water drink, as well as Naked. It's also a sugary beverage fruit drink, as well as Gatorade and many, many more that you've probably seen in the drink dispensers and the vending machines on campus. And so we're really trying to highlight the fact that there's many parts of sugar-sweetened beverages that are available to students, and we want to note that sugar-sweetened beverage is the leading cause of obesity as well as diet-related disorders, like I had mentioned before, and we are cognizant of what's being offered to you all as students and also to just the general UC Berkeley community, and trying to address how we can play a role in being more active in what we have on campus and how we can have more of a role in saying what we would like to see in terms of the food and beverages available here.
So what are your thoughts on boba?
Everything in moderation is okay.
Thank you. Our next question is, an environment where mental health and nutrition are often ignored, especially at Berkeley, how do you think we can help raise awareness of these issues to our fellow peers? What can we do as sort of ambassadors of this issue to make it a better environment for everybody?
It's an interesting, I think, framing of the question. I think it's good to think about how peer-to-peer you can support one another, but I also think it's important to name and acknowledge the ways in which other entities on the campus can raise this awareness. I think for me, again, there's this theme that's coming up around not having silos, and so really wanting to make sure that when we're talking about mental health, we're also having conversations around food and housing insecurity, or the reverse, so that whenever an individual is navigating a different resource, or an individual on campus, or even in conversations peer-to-peer, that those are aspects of the conversations that are included. I think about the ways in which the culture of this campus in particular, you know, with being a top-tier public university, there's a lot of pressure in terms of academic performance. And so I think in terms of whether we're talking about a staff modeling to students or students modeling this to one another, but really lifting just overall wellness and being able to prioritize mental health, or even having really good boundaries related to your academic work. I think that it's one thing to talk about it, and it's another thing to model that for one another. And so I try to do that also as a staff member. I know you'd mentioned working after 5, that's not a problem, but I think, you know, in terms of having conversations when you're at your capacity, obviously burnout is a conversation that, you know, people are often having, and burnout is, in terms of that language, it can mean different things to different people. It also shows up very differently. But when we're really thinking about what that looks like when you break it down, oftentimes that's about trying to juggle a lot of different stressors at the same time. And so I think the more that we have these conversations, the better it is in terms of normalizing how challenging it is, not only to just be a student managing your academic workload, but then also what that means if you're struggling in terms of finding a place to live, or not having access to food. And so as a community, we really want to be able to open up these conversations, again, to really normalize this. Just the data that Sara highlighted earlier, I think speaks volumes in terms of this is not something that is happening to a small set of students. This is a large part of our campus community. So that's, again, a certain percentage of this room. It's almost half of this room if you think about folks who are struggling with food insecurity. And so I think really being able to lift that data and really being able to think about how that shows up in our day-to-day conversations is really important.
I think Kiyoko highlights a really important thing that for us to all think about for mental health. It's that I think it's just really important to seek help and resources when you can, and when you're engaged in a part where things become too much, it's important to definitely seek out resources. Another thing I would add is just that in terms of making sure that you are able to, when you're able to necessarily look for certain things to access everything as well, it's important that what's in your environment is presently like, quote, like good for you. We want to be able to present something in the system, in the food system here, that is going to be able to help support you in making sure that you have the cognition and the nutrition that's necessary for you to think about things and for you to continue your journey and energy that you need to conduct your daily life as well. And that's why I think there's a strong focus and emphasis that we're making to ensure that the campus food environment and system is able to bring you something that has more nutritious and more healthy options. That way, if there's a need, you can choose to make whatever choice that you want, but we hope to just promote healthier choices that are available on campus.
So a lot of our conversation has been around student basic needs insecurity, but Joyce, I know that you work closely with Rosalie, who's really spearheading the basic needs insecurity alleviation efforts among staff. So would you mind telling us a little bit about that?
So at the moment, as of December of last year, actually, we started to expand access to the food pantry to staff as well, because we've noted that staff members are also not necessarily meeting the basic needs that they have. So many workers here, especially in the Bay Area, are currently in a spot where they're making, the Berkeley wage, but at the same time, the cost of living here is rising tremendously in the Bay Area. So there's a large discrepancy about what they're being paid and how much they're also paying to live here and work here. And we have looked at ways to both see their food insecurity levels at the immediate level, so allowing them to access the food pantry here at UC Berkeley, and also induce efforts to make sure that they're being seen for CalFresh opportunities and for them to sign on to more sustainable efforts, and to also have a conversation regarding the wages that these food workers, for example, are earning, or those who work at the custodial staff at dorms. We're really trying to make sure that they themselves, the people who typically serve students, are also able to be served themselves to work here and support all of us at UC Berkeley.
Yeah, and going off of that, I know that at Cal Dining, a lot of the workers are actually fired at the end of the academic year and then rehired at the beginning of the next academic year. And that causes a lot of problems when you have this 3-month period where you don't have any wages, and it's also impacts the amount of wages that you get. In addition, the national tip to minimum wage is actually $2.13, and it's a loophole for chain restaurants like Olive Garden to be able to pay anyone who receives a tip a minimum wage of $2.13, as long as the tips they get add up to the national minimum wage of like $7 to $8. So that's just something to keep in mind. If for a lot of people, the food industry is one of the first places they find their first jobs. So just keeping in mind the companies you work for, the restaurants you work for, how they treat your workers, because that can impact the way you view how the workplace is in the future. So I know both of you are working on some really exciting projects, and a lot of people here are involved in some capacity, but also may want to get more involved. So could you describe a little bit about how some of your current projects are uplifting and cultivating better holistic wellness, and just a little more information about anything upcoming that people might be interested in?
All right, so I'm going to talk a little bit more about the Coalition for Campus Healthy Beverages, Healthy Food and Beverages. So currently we are aiming to capture 3 main projects, the first of which I hope you all are very interested in getting involved with. We just today launched our website for this. We're planning a hackathon-like competition called the Healthy Campus Food and Beverages Innovation Challenge, and we're working closely with Feed as well and Sara to jumpstart this. And we're really hoping to plan out something that will be the future beverage vendor service on UC Berkeley campus. And we're really trying to keep in mind of a couple different themes that we wanted to make sure to hold corporations or just businesses responsible for their actions to promote health and sustainable wellness, as well as to have this driving promotion of just overall health on campus, whether it be physical or mental as well, and ultimately to ensure that there's still choices available to students to choose what they want to eat and drink, and also just to have all of those principles and the values that UC Berkeley holds very dearly to their hearts. And another project that we're working on, and I'll describe this a little bit more later, another project that we're working on is just trying to capture the overall beverage landscape in UC Berkeley. So for example, we're trying to figure out how many types of sugar sweetened beverages are offered on campus, as well as how prevalent the advertising it is for you to see the PepsiCo brands here as well. We just want to make sure that we have all this information to understand what students and everyone who's on campus is facing. And one last thing is we do have a sign-on for everyone. So if you're interested in hearing more or joining this coalition, you can find it on our website.
the one thing on the Basic Needs Center side, and I want to do one shout out. So Sam Koo is our new Basic Needs Center coordinator. So I just wanted to make sure to give that shout out. So as Sara mentioned, we just opened our Basic Needs Center 3 weeks ago. And so one thing that's really exciting is that, again, with this idea in mind that we really want to think about a student's holistic needs, again, not just thinking about food, housing, and finances, is that right now I'm providing case management for students who have any sort of basic needs issue that comes up. So what we're actually doing for next fall for the first time is we're partnering with the Masters of Social Work program, and actually are going to be having 2 MSW interns work with me to provide case management. I think the vision in the future is actually to have mental health services provided outside of the center as well. Again, so the idea that if an individual is experiencing various stressors related to food, housing, and finances, that they can also be able to meet with someone in terms of getting their mental health needs met as well. So that, again, all of those needs could be really kind of met all in one center. The other thing that, if all of you don't know yet, so of course most of you are familiar with the food pantry, but one thing we do have in terms of this partnership with thinking about how we're also building individual skills related to, as Joyce mentioned, healthier eating options, but also how to maximize your food budget, is that we have different nutrition kind of food demonstrations every Friday outside of the food pantry. And so that's really important too, to think about how you can take the food that you get in the pantry and actually make meals that you could prep for yourself. This is a little bit far in the future, but we received a CACSIF grant for a community kitchen. And so over the next year, we're going to be working to build out the kitchen that we have in the Basic Needs Center to make that really available to everyone on campus to come, you know, get the food that you have from the pantry, come to the community kitchen to prep that, and then also share a meal. So that's a work in progress that we've been in the planning process phase, but will be kind of you know, executed in the next year or so. So some really exciting things are happening. Again, we just opened our doors, so I think there's a lot of room for those sorts of partnerships and exciting kind of creative ideas.
So the next question is, how can the students here get more involved in these efforts?
You want to answer the question?
Volunteer, intern. How many people here are food pantry volunteers in hire? Woo! How many people here are currently interns with basic needs or have been interns in the past? So I do want to give a huge shout out to them, because I started as a food pantry volunteer, and oftentimes our shelves were empty, people were missing hours, and there were times when the pantry wasn't open and people were lining out the door waiting for emergency food. But now Stella, who is in lab with her mice right now, she leads a 65-member volunteer team and has expanded the food pantry to be fully stocked. It's open Monday through Sunday, morning to night. It's the only campus pantry in the country that's student-run and fully staffed from morning to night on 7 days a week. So some ways you can get involved is just volunteer. Simon, can you raise your hand? Yeah. Food Pantry does restock every Tuesday and Friday, and they always need help. People like shelving Cliff Bars and pasta, juice. And they Simon also runs along with Vanessa, the pop-up pantry, so in front of Moffett and in front of Worcester on Wednesdays and Fridays respectively. He's out there with a cart and a big sign that says, you know, come hear more about the food pantry, because we recognize that the Basic Needs Center in the basement of MLK is not super accessible, so we want to make sure people all across campus are aware of the resources that are offered. So huge shout out to Simon and his team. Yay. And if you're interested in getting involved in other respects, we also have an internship program. You can get units, 1 to 2 units per semester, depending on how many hours at the beginning of every semester. And finally, we are actually running a basic needs referendum in this upcoming ACUC election cycle. And Regina, can you raise your hand? knows all about it. But basically, the TLDR is on the ballot. You put in your name, and then it says basic needs referendum. Just click yes, and then woo! It's very simple. And then if you have questions about what the referendum is, we can talk about it after.
The other thing I wanted to mention, so in terms of our timeline, so Sam, our Basic Needs Center coordinator, is actually in the process right now of recruiting volunteers to work at our front desk. And that's a really critical position, partly because it's the first point of contact that we have at our center with any sort of guests on campus coming to us. And again, that's a wide variety of folks already who've been in our space, so not just students. I've had former students hear about us to come ask me about housing questions, a lot of folks who are curious about the research we're doing, and so it's a really exciting position. So please reach out to Sam if you're interested. I know it's an interesting time point in terms of the semester, but again, we'll be recruiting for interns and volunteers for the Basic Needs Center early in the fall.
So I shared a little bit about some of our upcoming events, including the hackathon. I just want to point it out there again. It's a non-tech hackathon. It's an innovation challenge where you're really trying to tap into your creative minds to think about what it's like to intersect both health and business, and to think about partnerships of UC Berkeley into the future. And it's going to be happening around like April 26th, 27th, so keep it on your radar. Another thing I'd like to point out is that after working in this space, like the students at BFI felt like we were very inspired by what we've seen, just trying to understand what the PepsiCo contract looks like, and we're actually launching our very own advocacy campaign for healthy beverages on campus. And our main goal is really just to look at the transparency of like who is involved in being able to choose what businesses we worked with. We really want to be a voice, like we as students, like being the main target like audience for those who shop on campus for food and beverages. We really want to make sure that our voices are being heard, and we would like to be involved in the decision-making processes and having it be more transparent. So we're reaching out to a couple of different student organizations, as well as just people and all of you out there to help us with this campaign. We'll be giving news like soon. We haven't fully finished our clarification message, but just keep an eye out and an ear out for all of that too.
And then adding on to that, the Innovation Challenge is really cool because we have a really inspirational partner on board. He actually leads a lot of non-tech and tech hackathons around the world, including in Africa, and recently did a bunch of United Nations SDG hackathons. So he'll actually be leading a workshop during the Innovation Challenge. So it's also a great way to have some professional development experience and spend a day or two just brainstorming ways we can improve our campus together. And if you have any questions about that, Joyce will be here after the panel. We're going to move on to the Q&A. I know Merced folks are currently watching through live stream, so Frank's actually going to be texting me questions when they come up, and he's typing. Oh, he said we wanted to say hi to UC Berkeley. Woo! Yeah, that's the projector. Wait, can everyone just shout like, hi, UC Merced? Okay, go. Okay. Hi, UC Merced. Did you hear that? Oh, no one here has questions, comma, sorry. Okay. Oh, okay. Kiyoko actually, I don't know, I'm talking to my phone. Kiyoko has a question for Merced people, so.
No, I was just curious if they have Merced time, like Berkeley time.
Oh, okay. I'm seeing if he...
That's a terrible question, sorry.
No, it's okay. There are no terrible questions here. Yes, Simon. Sorry, I'm like calling him right now. Yeah?
It's interesting. Oh, so it sounds like the question from Simon is that if one of us were interfacing with a student, in this case was a graduate student, who there's that culture of kind of taking pride in not sleeping and, you know, working all hours of the night, you know, just because you're like getting it in and really just trying to do as much as possible and, you know, putting everything else on the back burner, what I would say in response. I mean, I think the context, like you said, is a one-on-one conversation. I think for me, I always start any sort of conversation with curiosity rather than starting to give unsolicited advice. I think I would really want to understand what it is about, you know, taking pride in burning the candle at both ends. Like, why is that so meaningful and why is that important? And also, what would it look like for them if for some reason they were to shift that a little bit? Again, not saying that they're going to neglect their academics, but what would it mean if they were to incorporate starting small but one element of wellness? So maybe trying to get an extra hour of sleep. For me, I feel like any sort of change is very much centered in each individual. And so me coming with my own agenda isn't going to be helpful. And so, you know, that's why engaging in a longer term relationship with someone would be really important, because those sorts of things, it's about really, again, understanding what's driving an individual and starting to think about their willingness to change. Because in this case, Simon, you know, maybe it's working for them. I think I would wonder, you know, and the questions I'd want to ask is that what is the sacrifice though? Are there relationships that are being kind of sacrificed in that? Because oftentimes there's also something that's not working, right? And so really utilizing that as a frame to potentially shift their willingness to change and also try something new. Again, I think it's hard when that's the culture, that you just work you know, all throughout the night and are really just exhausted. But I think it's about starting small and thinking about small steps to incorporate any sort of change there.
I think Kiyoko put it in a very beautiful way of, like, from her case social work background, and I really appreciate the fact that you don't really want to give any unsolicited advice. You want to make sure that they feel like you're not making assumptions about them, and it's not like they feel like they're being attacked in any way. I do think that, like you said, in like describing it as a stigma, I feel like would be also helpful to just denormalize that conversation, that having a lack of sleep or like working throughout the night and having it feel good, like let's denormalize that conversation and check in with them, like ask them like, oh, if they said they weren't able to sleep as well, just check in. It's like, oh, are you okay now? Like, how do you feel after that? It's just checking in and make sure that it's not something that you are contributing to, but instead you're actually trying to make the norm about health instead of like hard achievement in that sort of manner.
Hi. My question is, so I feel like there are two tiers of things we talked about in terms of, first, like having food security, so like not being hungry, versus the second tier seems to be making healthy choices with the choices that you have. So I was wondering if there are further advice on how do you make people think healthy from an institutional, I guess, tactic. Because I think a lot of college students here eat ramen a lot. So I was wondering, from the institution level, how can we promote healthy thinking in general?
So this is what I consider. So I feel like the topic of like food insecurity and food security is a conversation of not only just like being able to have a consistent access to food, but also to healthy food. And I think it's really important that we consider the nutritious value of what we're also putting into our body. And I think what is the challenge is that food access depends on many different factors, such as the convenience of being able to access, let's say, something like a cup ramen noodles, or and the convenience of being able to cook that very quickly and have it be a food that is made and consumed within like 15 minutes or so. And I think this is a bigger conversation. And what the main purpose of looking at food security in this level is making sure that the access that they have can match up to something that's like a cup of ramen that can be easily made, and to make sure that like healthy foods is not only accessible, like it's within our institutions, it's within our shopping areas, it's present, so we can have that choice to make that option, and to also have the costs be familiar and comparable to that of something like cup ramen. And so I think that's the big struggle that we're coming with, and I feel like there's been a lot of work at the moment to figure out, like, behaviorally, how do we have people make healthier choices rather than unhealthier choices. And some things that have worked previously in the past is like looking at incentives and also disincentives as well. So we have here in Berkeley the Berkeley soda tax, and that is currently a tax that's being put onto all these sugar sweetened beverages around the city of Berkeley, and that's known as like a disincentive for people to drink less sugar and sweetened beverages. And there's also other incentives, such as having the program called Market Match at farmers markets. It's a way for SNAP or CalFresh recipients to be able to have double their bucks when they shop at farmers markets, and that way they're able to purchase food that are healthy and fresh, like California grown fresh fruits and vegetables at a more comparable cost, and still be able to have that mission through. And even within like some of the financial assistance programs that we have, like CalFresh, we also have a support system known as like SNAP Education, which is also helping to raise the idea of healthiness and to raise the idea of like food choices that could be healthy, like further up on someone's mind. But it is a very difficult thing to consider at the moment, and I really I can really relate to that myself as a graduate student. Yeah.
So I like how you set that up into like the tiers, like first basic needs, and then second thinking about health. So in this space of holistic wellness, like in the food space, have eating disorders been a topic of discussion in these spaces, because that's a place that totally overlaps these, like the mental health, physical health. Yeah, I'm curious if that's been a topic of discussion in any of the spaces you've worked in.
I think what's interesting about your question, and I think it's a really good one because it's very relevant, but often issues related to eating disorders and even someone's current mental health diagnosis, those are very kind of protected pieces of information related to one's kind of, their mental health record or physical health record. And so because the work that we do in terms of that inverse pyramid model that Sara went over, it really isn't at an in-depth level where we're providing intensive support related to kind of physical health, right? And so I can imagine that that comes up more for the UHS folks. So I know that it was actually National Eating Disorder Awareness Week, the last week of February. And so Tang and UHS really, I think, have been doing a lot of overlapping outreach with the nutrition health, or I think the health outreach workers and the nutritionists. But I think that's something, because the nature of our work isn't providing that one-on-one mental health support yet, or providing any sort of health-related support, at least in the basic needs world. We haven't really kind of dove into providing that level of support.
So I'm not as well versed into this as much, but I know in the conversation of public health and as a and as my role to become a registered dietitian, these are conversations that do come up and that we have, but can't state too much to this point as much as I would like, but I would love to follow up in the future if I learn more about it. Yeah.
Can we get a huge round of applause for our speakers? Woo, raffle time. Okay, so what I've been doing was using a random number generator and just picking numbers. So, no, I didn't lie. Okay. So I'm going to start with the mason jar sustainable milk tea kit, and then we actually also have these phone rings. So 10 lucky winners will also get this. So almost everyone will get something. All right, so the first person who got the mason jar was Lilia Kuroda. Woo! Yes. You can come up after. Yeah. Ryan Choi. Woo! Emily Sue. Jade Wong.
Yeah.
And then Nat Kim. Is Nat here? Okay, cool. Are Jade and Emily here? But someone will bring it to them. Okay, great. All right, the next is the phone rings. I'll just start from the top. Vanessa Tan. Woo! Is Vanessa here? No? We'll figure that out. Sydney Wexler.
Yeah.
Marley Perokta.
Oh, Marley.
Brandon Chen.
Nice.
Jesse Thiara.
Ooh, lucky.
Okay. Catherine Solar.
Ooh.
Kristen Ho.
Everyone's gonna leave with the prize.
Alvin Yu. Susie Warner. And then Joe Canis.
All right.
Yay! Yeah. Oh, we're done. Thank you. All right. Thank you for coming.
Woo!